And medicine on the cutting edge tonight in the fight against heart disease, growing new arteries from scratch.
From ABC News World Headquarters in New York, this is World News Tonight with Peter Jennings.
And at the end of the broadcast tonight, growing brand new arteries for a diseased heart. That is definitely medicine on the cutting edge. Growing legal fees when we come back, growing arteries. A very promising new treatment for people with heart disease. Finally from us this evening, medicine on the cutting edge. More than 6 million Americans suffer from angina, or chest pains caused by a lack of blood flow to the heart. We've done reports on a variety of treatments which work for some people but not for others, bypasses, stents, and things like that. Tonight, a report about doctors at the University of Cincinnati who are providing blood to the heart in a very new way. Here's ABC's Barry Serafin.
Despite 3 heart operations, including a quadruple bypass, Cincinnati mail carrier James Duke said he felt like an elephant was on his chest.
Constantly hurt. I'd be at home. I want to get out and walk in the park and stuff like that, and I couldn't do it because I get real tired.
But since receiving an experimental treatment for his blocked arteries, his pain is gone.
And I really feel great.
Duke was one of the first heart patients in the country to be treated with a protein actually capable of growing brand new arteries. The genetically engineered protein is injected directly into the heart. Within days, a network of new vessels begins to grow around the blockage, increasing the blood supply. Dr. Lynn Wagner showed us the changes in one patient's heart.
We see a small, narrow main artery and not very many secondary and tertiary arteries. This is after the treatment. What we're now seeing is new blood vessels growing here off the end of this artery.
And the patients themselves?
Symptomatically, they're improved within a couple of weeks of the treatment.
Just ask Constance Donnelly.
Oh, I feel wonderful. I've never felt so good in the last 5 years.
The growth protein is still in the testing stage, but doctors already see potential in other cases where the blood supply needs a boost, such as strokes and diabetes.
It's a very exciting, promising treatment for patients, both with heart disease and with other cardiovascular diseases.
Tests have only been underway in this country for 6 months on a handful of patients. If they pan out, the treatment could be available in 3 to 4 years. Barry Serafin, ABC News, Washington.
That is our report on World News Tonight. I'm Peter Jennings. We hope you have a good evening. Good night.